So here I have the common diseases that I see in the office. And in many cases, it's not just the list that you see, it's also a combination or supersized diseases all appearing in one patient. If you come in early, if you come in at the beginning of the disease process or the disease presentation, you might be able to get just one of these, but many times because, again, like I mentioned in the earlier slides, we as doctors are very used to putting Band-Aids on things with prescriptions and not taking care of the cause. So if it was an anxiety issue and all we did was give Xanax and did nothing to change around the way you relaxed or the way you saw those stressors or those triggers, and you kept on seeing the triggers, there's only a matter of time before the medicine has to be doubled, tripled, and then you have to be on 2 medicines, and then eventually they don't work because you don't take care of the cause. So if that happens, then a second problem comes up. And unfortunately, fibromyalgia, irritable bowel syndrome, sleep disorder, which is part of fibromyalgia, chronic fatigue are usually all in the same boat. And if you come in with all the diseases at the same time, I certainly can still design a template of change depending on which is the biggest problem, but it doesn't matter if you have single or if you have a combo, supersize, everyone suffers. And the idea about suffering is it's going to be very difficult. Is it the individual problem? Is it the combination of problems? Is it the medicines that gives you the suffering? It's going to be hard to kind of figure that out. But again, if we work on thinking, eating, and activity, no matter how painful, it might be, you might be able to chip away at one of these, put it away after a couple months, take care of the next thing, put it away after a couple months. It'll probably take years, but which way are you going now? If you're on the way to seeing the specialist and going to Mayo, they'll probably give you the once-over look at everything that the doctors or I have done and then say, yeah, I agree, it's this, this, and this, and you're not a surgical candidate, so continue what you're doing. So I love taking care of sleep disorders. I think that's the easiest thing to take care of first, just because Americans are we're so pushed to not get enough sleep. I think we learned that in college. Kind of push the envelope before a test, an all-nighter, and then make up the difference in sleep later. Well, it doesn't last for a long time, and we're not bulletproof like we were in our 20s, most of us that are 40 to 50 years of age. So I think there's a lot that can be said just by changing around the sleep pattern. And you can see my tutorials on my YouTube website about sleep, how to improve sleep, herbs that help with sleep, how important it is. Just that alone is the first step and usually easiest to make an effective change with.